Well, my issues with going to the dentist and my phobia actually started when I was quite young. Partly because, even as a child, I had a widespread dental caries, so I had to go to the dentist a lot, along with my parents who also had problems with their teeth. They had obviously told me stories that had an effect on me, so I always struggled with the idea of the dentist and just avoided it. Together with the neglectful tooth care, needless to say, it gradually became a major problem for me. Over time, this combined with a sort of fatalist approach, thinking it would just happen again anyway, but of course, that's just nonsense. The whole thing escalated to the extent that I actually started to lose teeth from my upper and lower jaw. When it comes to the dentist, when I did eventually make an appointment, I would sleep badly for a week beforehand. In truth, it became increasingly dramatic until it got to the point where I just couldn't do it anymore. I don't have much customer contact in my job, but there is still some. And so, I would suppress a smile, look away, use my hand to hide my mouth somehow when speaking. But that's not great. It was actually my wife who got in touch with the practice. She'd been pushing me little by little, saying I had to do something about it. She did some research online and searched for dentists who were specialized in dealing with phobic patients. Among others, she stumbled across Smileforever. I read through some of the reviews and it actually sounded really good. Without even talking it over with my wife, I called up one Monday at noon. It must be almost exactly 5 years ago. And contacted the practice for the first time. What struck me was that even arranging an appointment was completely different to other practices I'd known in my life. They immediately tried to find me a prompt appointment. That was partly down to the fact that it wouldn't give me much time to wait and develop new worries and sleep badly, so that I wouldn't suffer too much before the appointment. And so then, on the next Wednesday, I came to the practice for the first time. That too was completely different to what I was used to. I wasn't taken straight into the treatment room, asked to open my mouth and given a stern dressing down, as had been the case with dentists in the past, saying, "Oh dear, would you look at that, and what poor dental hygiene." Instead, they just came and sat down with me in the waiting area. Dr. Desmyttère spoke with me for a good hour, asking where my problems were, what I'd like to achieve, whether I'd prefer to have lots of smaller appointments or could imagine having just one big appointment. That stirred a great sense of trust in me. Only after we had spent an hour together, we went into the treatment room for an examination of my initial situation. I decided to have one big appointment. Ultimately, it took almost a year to get everything ready for this major treatment because obviously it proved difficult to convince my health insurance to cover the procedure, as the costs involved were pretty huge. But the practice and Dr. Desmyttère also supported me in this regard, helping me to get everything approved by my health insurance. Then in May 2015, in a 7.5-hour operation, performed on an outpatient basis here in the clinic with 2 anaesthetists present, I had all the teeth removed from my upper jaw, plus 3 teeth from my lower jaw. Then, late in the afternoon, my wife came to pick up what was left of me. I was very surprised in the evening when I tried to open my mouth, that I actually had a full set of teeth in the form of a prosthesis. The days that followed were also quite surprising. Free from pain at the treatment sites without any strong medication. I also had a consultation with the anaesthetist ahead of the procedure because, for such a long anaesthetic, he obviously needed to find out about my medical history, to figure out what dosage I needed and and whether there were any risks involved. That was all fine. Everything was completely harmless, not painful at all. I was quite surprised by myself, by how relaxed I was, going into these appointments without any real fear. At this point, I have to say that I found it really admirable how meticulously the doctor went at the situation. There had been a few situations where he wasn't satisfied with the work from the lab. He very quickly and unequivocally took the patient's side and didn't try to cover up any sloppy work from the lab. The final results really are his top priority. You really do get the feeling that something is only ever good enough when he's happy. He makes a very clear distinction between what is medically necessary and what would be medically advisable. He primarily bases his work on what would be medically advisable, together with an anesthetic image. Of course, as we know from the media, there are so many people who've had treatments nowadays. You instantly know that somebody's got an artificial dental ridge the second they smile. That's naturally something he wanted to avoid by hook or by crook. My fear is totally gone. And so today, I can make an appointment at the practice and my heart doesn't race to anywhere near the extent it used to. Even ahead of this visit, making the appointment for the video recording today was really easy. I no longer think to myself, oh God, now I have to go back to that house of horror. No, I come to the practice 3 or 4 times per year for professional dental care and tooth cleaning. Since then, there's not been any significant events to report or any need for further treatment where I had the operation. Everything is tip-top. Now, when I look in the mirror, I'm sometimes surprised by the appearance of my teeth these days. They're better than my first or second set of real teeth ever were. I don't need to hide my smile anymore. I love to smile. My phobia of the dentist is completely gone. It was a great stroke of luck for me. I think it's very important to look for a dentist who you can genuinely build a trusting relationship with and who doesn't give the impression that the relationship is just that of a client and a service provider. With this relaxed yet highly professional manner, Dr. Desmyttère genuinely has attributes that allow him to connect with people. He's always dependable, including when there are little problems to deal with.